afternoon, everyone, and welcome to our webinar today. We are so fortunate with the partnership that New Hanover Regional Medical Center has entered into with Novant Health that we have access to even more good healthcare information, solid information to help us make good choices and to make us a healthier community. It truly is a remarkable day in southeastern North Carolina with this partnership. We are joined today by Dr. Charles Bregier, who is the Medical Director of Novant Health, and he will talk with us about the COVID-19 vaccines and the pandemic in general to a certain extent. Folks, we are not out of the woods yet. There are some parts of our country and parts of the world who are seeing another spike. We need to keep our the attention to being safe. We need to stay on that. We need to ask Dr. Bregier questions after he makes his presentation that help us make good decisions about how we continue living and begin that process of getting back together again as we all miss it. So Dr. Bregier, we're thrilled to have you here with us. Dr. Paul, thank you for also joining us. We know that some questions might pop up today and that you're with us to help answer that, and to also introduce Sean Erdman of Novant Health, who will help to moderate the conversation. I'd like to welcome all of you who are here, including those of you who may have joined us from outside New Hanover County, as Novant Health is the healthcare system of the entire region, and we're thrilled that you were able to join us today for this opportunity. Dr. Bregier, I'll turn it over to you.
Thank you very much. Appreciate it, Natalie. Good afternoon, everyone. Appreciate you spending some time this afternoon to share some words, share some thoughts, ask some questions regarding this ongoing COVID-19 pandemic. And as Natalie mentioned, I will encourage you, as we're going through the presentation, please go ahead and submit questions you may have as they come to mind in the Q&A, and we will go ahead and answer them pretty much as best we can at the end of the presentation. It'll probably take about 20 minutes or so. Sean, I think that you're up for next couple of slides.
Sounds good. Thank you, Dr. Bregier. Good afternoon, and thank you for joining us for our webinar on returning to work during a pandemic. My name is Sean Edmond with Novant Health Corporate Health, and I'll be the moderator for today's session. During this presentation, if you have any questions, please feel free to submit those through the Q&A feature through Zoom. Our speaker for today is Dr. Charles Bregier, who you just met. Dr. Bregier is the Medical Director for our Corporate Health Department and serves as the Employee Occupational Health Medical Director for Novant Health's 29,000 plus team members. Dr. Bregier is a certified medical review officer with extensive experience managing the full spectrum of workplace injuries and wellness programs. Dr. Bregier also oversees drug and alcohol testing programs for many employers and has created numerous workplace wellness and exposure guidelines for corporate health clients across our footprint. Dr. Bregier has spent the last year fully engrossed in the Novant Health COVID-19 response and has assisted us in getting our own team members back to work safely. Also joining Dr. Bregier will be Dr. Wes Paul, who is the Chief Clinical Officer for New Hanover Regional Medical Center. Dr. Paul provides oversight for clinical quality and safety, clinical practices, and the system's medical staff. Dr. Paul will be able to answer any questions regarding the merger with Novant Health and any questions specific to the Wilmington area. Our goal today is to give you some information to help you keep your business open safely and return your employees back to work. Our agenda today will include talking about the state of North Carolina, where we're at, workplace considerations and how we can accommodate our workers, and then some information about the vaccines. So without any further delay, I'll turn it back over to Dr. Bregier.
Thank you, Sean. Next slide, please. So I'm going to start off just talking about some of the numbers, and I think this just helps add perspective to kind of where we are. So at the top there, we see that there have been 148 million vaccinations given across the country, which is better than we had initially projected. I think we're running ahead of schedule now. It's taken a while to get this vaccination train rolling, but it's really rolling now, which is great. And we know that President Biden has made it a goal to get over 200 million vaccines distributed and in arms within his first 100 days, and I think we are on track to meet that. So there have been over 30 million positive cases of COVID identified, and unfortunately, over 550,000 deaths in our country. Just to put a little bit of perspective on that, In World War II, there were a little over 400,000 deaths and about 40,000 deaths each in the Korean War and the Vietnam War. So you can see the death toll we have incurred in this terrible pandemic has exceeded the 3 worst wars we've been involved in the last 100 years. Here in North Carolina, we've given almost 3 million vaccinations. We have had 912,000 cases and about 12,000 deaths in the state. So as Natalie mentioned, we need to keep going. We need to keep our perseverance alive in this pandemic because we're not through it all yet. Now, we'll talk a little bit more about that as we proceed with the presentation. Next slide, please, Sean. So there's a whole lot of information out there everywhere you look about COVID. There's a lot of good information, and unfortunately, there's a lot of misinformation out there. There's been extensive modeling that's been done by a lot of people who may or may not have good science behind what they're doing, which has caused in sometimes predictions of much worse numbers and of the different surges we've incurred, and sometimes numbers not quite high enough. And so please consider sources when you're looking at information. You know, I think that a lot of things that are posted on social media are not necessarily based on science or real data. So just kind of be aware of that. What we do know is that we do need to continue to do the safety measures that we have learned over time. So back in the beginning of the pandemic, we really didn't know very much. And some of you may remember that early on in the pandemic, CDC didn't even recommend masking at first. And now they're recommending masking everywhere, and even in some instances, double masking to keep people safer. And so we know that we are wise to continue to wear masks. We know that we're wise to continue to social distance. We're wise to be very cognizant of keeping our pods small. That means your core group small. Limit your interaction and close contact with those around you who are not part of your pod to keep you and your family members safe. Fortunately, we are well into the vaccination program, and that's going to help increase the ability to safely interact with people, especially as we get close to the herd immunity number of 80 to 85% of our population immunized and or having had the COVID virus. Next slide, please, Sean. So I'll talk about testing for just a couple of minutes. So what has been around the longest and is the best test are known as PCR tests. That's polymerase chain reaction test is what PCR stands for. They're also known as molecular tests or NAA tests, which stands for nucleic acid amplification tests. And these are the best tests because they really are able to find pieces of specific genetic information of the COVID-19 virus, identify it, and able to effectively see it much more easily and broadly to identify it. These are very sensitive tests and very sensitive and specific tests, which means that they're very good at actually detecting COVID, not very many false negatives. And if in fact they are a positive test, it is most likely to be a true positive test, which really speaks to the positive predictive value, especially if you're in a community or a situation where the community spread of COVID is relatively high. So what has come out more recently are antigen tests, and the specificity is good, but the sensitivity is not so good. It says 84 to 98% on this slide. In actual fact, what we have learned since these have come out is that probably the sensitivity is closer to the 84% than the 98%. Some of the 98% numbers came from some of the clinical trials that were done before these tests were brought before the FDA for emergency use authorization, and the numbers we've been experiencing are not quite as high. So some words about antigen testing. So if you have someone who's sick or has had a significant exposure, and the right interval of time has gone by to test them, meaning 3 to 5 days if they have had a significant exposure. If they have a positive test, it's likely to be a true positive test. But if you have someone in particular who has had symptoms, may have had an exposure, and they have a negative test, it is not a conclusive test. The sensitivity is not high enough. So authorities recommend that a confirmatory PCR test be done in the meantime while you're waiting. And anyone who has had symptoms and has an antigen test that's done and waiting for a PCR test to return really should be remaining in isolation while they're waiting for that test to come back. So antibody tests have also gotten a lot of press, and antibody tests are really not all that helpful in acute settings. They are sometimes helpful if someone thinks they may have had COVID a month ago or 2 months ago, and to see if they have the antibody. It may be helpful. It may prove to be more helpful later on, depending on what is recommended by CDC and FDA regarding if any recommendations regarding doing antibody testing on people who have received the vaccine comes out, but there have not been recommendations along those lines to date. All right, next slide, please, Sean. So OSHA has put out an excellent pamphlet on COVID safety. It came out about 6 months ago or so. I have not seen a recent update to it, but it has a lot of good information in it. It's about 40 pages long. It has a lot of information that will be integral to your particular industry or your place of business in terms of things that you need to do to basically reopen safely, bring your team members back to work safely, and maintain everyone's safety. But we do know that as part of this, to do a hazard assessment to determine what kind of risks there are, whether it's people coming in close contact or the way the air is circulated or blown across people instead of being pulled out and up away from people, are things that need to be done. And you can get, different kind of industrial hygienists and others to come in and help you assess if you need to determine what needs to be done to keep your place safe. And of course, hand hygiene, social distancing, and wearing masks is very important in the workplace. We're seeing in particular that sometimes people will kind of back up coming in or out of the workplace. And it's important that people understand the importance of social distancing in the workplace so that they don't inadvertently get too close to others and accidentally spread COVID to someone else. Another area we're seeing difficulties is in break rooms and lunch rooms, where people are often taking off their masks, sitting too close together and socializing. And that's where COVID can be spread very easily and very readily. We've seen a lot of outbreaks to that effect as we've been going through this pandemic. It's important also that you have a method to pre-screen your employees and identify anyone who may be sick and have them promptly isolate themselves, remove themselves from the workplace, and most importantly, not present to the workplace if they have signs or symptoms of COVID disease. Just a couple of words on the information on the right side of the slide regarding return to work. We have gone away from test-based return to work guidelines in favor of time and symptom-based strategies for determining when it is safe to get someone back to work. And you as an employer really don't want to be hung up on having someone have a negative test if they have had COVID in the recent past to return to work. We have seen that there are often persistent positive COVID tests for weeks or even months after someone has had COVID, but it's not viable or replicable virus. It's just some persistent viral shedding that doesn't really have much meaning. So you want to use, work with your health departments. Health departments have done a great job across our state and across our country in contacting people, in identifying people who are at risk, identifying who needs to be in quarantine, and helping determine when people can safely return to work. And the vast majority of people, it's after 10 days of isolation, and some people with severe disease or some other situations, it may be longer, as long as 20 days. Next slide, please, Sean. So it's important to really engage our healthcare team with COVID navigation. It's important that anyone who has COVID be assessed and make sure that they are made aware of signs and symptoms of worsening disease of COVID. And we are here to help you with this. Novant is your new healthcare provider here. We are ecstatic to partner with you and your communities and this part of the state, and we can provide on-site visits, we can provide virtual visits, we can do things over the phone. We have an extensive network of providers who are here to take care of all of our communities, all of our team members, whether they're sick with COVID or have any other healthcare need. Next slide, please, Sean. So a couple other things to talk about. So one thing that has gotten quite a bit of press is the whole issue of misting and, spraying mist in workplaces. And I am not an advocate of misting. I think it can be a money that is not well spent. The most important things to do to keep a workplace safe is to keep it clean, and then of course to sanitize it by wiping down hard surfaces with a good antiviral cleaning agent like bleach solution, etc. Misting sprays stuff in the air. It actually can cause people to get sick if it comes down and gets in their eyes or their nose or their inhale it. Misting has not been shown to be as effective. I would really look hard and look for good data as to why you would want to consider using misting in your workplace instead of more traditional ways of cleaning, which are to frequently wipe down commonly touched areas like door handles and restroom doors and hand faucet handles in restrooms and other things. Change things around in your break rooms to not let people be able to sit more than 6 feet apart. Have wipes readily available and ask folks to wipe down the tables and commonly touched areas before and after they use it. Encourage people to take their masks off for as brief periods of time and to spread out breaks and lunches as much as possible to help reduce the risk of spread of COVID. Next slide, please, Sean. So we do have a variety of things we've touched on briefly, regarding testing in the workplace. At Novant, we do internally use our own pre-shift screening app for all of our team members. All of our team members are asked to sign in and fill out about a 10-question app to show that they can come to work, and leaders and security and screeners and others at entrances to our acute care facilities and clinics and administrative facilities and other places are often asking to show your screening, to show on your phone how you've gotten a green tile, a green light that says you are safe to come into work that day. We also have nurses and APPs and others on site who can actually do screenings and help you do screenings and help sort through who actually may be having symptoms and may need to be sent for testing. Also, there has been a resurgence of these temperature kiosks at entrances, and we have a number of them at the entrances to some of our larger facilities where they actually will take someone's temperature and when they come in an automated way, and will determine if they can enter the building safely or not. I will say that I am not an advocate of doing temperature screenings in isolation. I think it's important to combine temperature checks along with other screening modalities to make sure your WorkSafe is placed to come into the workplace. And again, it's really important that you have good policies and procedures to make sure that you are making it clear to all your team members and employees that they should not be coming to work if they're sick. They need to contact a doctor or do a video visit or whatever they need to do to determine if they need to be COVID tested or otherwise, and keep them away from campus, and have your policies and procedures such that people are not unduly penalized for not coming into work when they're sick, because we really are trying to do everything we can to stop the spread of COVID. Next slide, please. So talking about if your team members get COVID, it is important that they understand that they need to hook up with a healthcare provider to make sure that they know about signs of worsening illness and know when to go seek a higher level of care. There may be isolated cases of people who don't know where they were exposed or had a family member was exposed. There may be clusters that are determined to have happened in a workroom, in a lunchroom setting, or in a social setting, or a religious setting. We've all have seen a number of religious settings across the state, right, where there's been clusters of information. This is a place where, again, working with your local health department is very important to determine what is the appropriate contact tracing to do to identify who needs to be placed in quarantine. And of course, quarantine applies to people who may have been exposed to someone who has COVID or is now a person under investigation because they're being tested for COVID, and what people have they been around that need to be quarantined because of a close contact, which is defined as within 6 feet for more than 15 minutes in a 24-hour period. Next slide, please. So COVID-19 vaccine. So fortunately, we are to the place now where we have these mass vaccination campaigns going on across our state and across the country. I am proud to say at Novant Health, we have immunized more than 200,000 patients in Novant. And that, I think, speaks to our commitment of keeping our team members and our patients safe from COVID. Next slide, please, Sean. So this is kind of how it's interesting how the prioritization of who gets immunized first has changed over time. It was put out one way back in November, December, it changed in December, changed again in January, and it's essentially changed a bit since then. And where we are now is we're up to group 4. So group 1 was essential healthcare workers and long-term care residents and staff, and group 2 was some other essential high-risk workers, and group 3 included, the groups expanded from there. Group 4 got to be those in congregate living settings and there's a higher risk. And then group 5 opens up to the whole community. It's interesting that the timeline for adding additional groups, so as a group gets added, that group and every group that has preceded it are eligible to get scheduled for vaccines. And as of today, the last half of group 4 has been added, which was a week ahead of schedule. And now a week from today, all of group 5, which means everyone over the age of 16 will be available to receive a COVID vaccine. And you can see the link here. Visit getvaccinated.org to make your appointment. Please make an appointment and get your vaccine as soon as you can. Get whatever vaccine is available to you. They're all good, and we'll talk more about that. Next slide, please. So, basically there are 3 vaccines that have been approved to date in this country. 2 of them are mRNA or messenger RNA vaccines. Those are the Pfizer and the Moderna vaccines. And this is newer technology, has been around for over a decade. There have been a lot of broad clinical trials done to be shown to be very safe. The 3rd vaccine is the Johnson & Johnson vaccine, which is a more traditional vaccine technology where basically they put some of the genetic material in an inactivated adenovirus, which is a common cold virus that's been inactivated, so it cannot make you sick. And then this genetic material in these vaccines is injected in you. It prompts an immune response. The vaccines are very safe. They're very effective. The number of side effects has been very low. We've not seen any significant major side effects. And again, they cannot give you COVID-19. They can only protect you from COVID-19. So in the meantime, while you're going in line, waiting in line to get your COVID vaccine, please remember the important mitigating steps: wearing a mask, keeping your hands clean, and stay socially distanced. Next slide, please. I don't want to spend too much time on this slide, but this talks a little bit about some of the technology behind the mRNA vaccines. mRNA vaccines they're more delicate in terms of their fragility, which is why they have to be stored at very cold temperatures before administered. And it's very interesting because the way mRNA is in every cell in your body, and it's what all your cells do to tell your body, each cell in your body, what to do and what to make and how to function well. So these mRNA comes in and it quickly tells your body what to do in terms of manufacturing some of these proteins, which then stimulates your immune system to say, hey, wait a minute, this is not really part of me, it's not part of my body, and it stimulates the immune response, which is part of the reason they work so well. And part of the reason, at least, that a second vaccine is required, because these mRNA vaccines are broken down so quickly in your body that it often takes a second dose of them to give your body enough of a primer to get that maximal immune response, which is why for Pfizer, a second dose is recommended after 3 weeks, and for Moderna after 4 weeks. And really, the literature says you don't have to be too worried about that timeline. If you're sick or you get COVID in between and you have it drawn out, it's really thought to be totally fine to get either vaccine within 45 days of the first one. Even longer in some instances, and we've seen that, but really within 45 days is fine. Next slide, please. So basically all these, we talked about this already. I guess I got ahead of myself just a little bit. 2 doses are Pfizer and Moderna, 1 for J&J. They all work very well. The most important takeaway point for all of these vaccines is that all of them have been shown to be extremely effective in reducing the risk of severe illness, hospitalization, and death. There are some differences, perhaps potentially in the statistical chance of completely avoiding a COVID infection. But really what matters at the end of the day is keeping people out of the hospital and saving lives. And all 3 of these are very effective at doing that. And one advantage that Johnson & Johnson is it just takes just one dose and you're done. So they're all good. Get whichever one becomes available to you first. Next slide, please. All right, that concludes the presentation, and I hope that this has prompted some questions in your mind, and Dr. Paul and I will be more than happy to address any questions any of you may have.
Thank you, Dr. Bregier. We are waiting on a question to come in. Dr. Bregier, have you noticed any side effects to the vaccines that are worth mentioning?
So it is not uncommon anytime one gets a vaccine, including the COVID vaccine, to have some relatively minor side effects. These include some local pain or swelling at the injection site, a little low-grade fever. It may just feel kind of blah and run down for a few days, have some muscle aches. They generally start within a few hours to a day after receiving the vaccine and resolve within a couple days. We've seen very infrequent incidents of more serious side effects like severe allergic reactions. That's thought to be about 1 or 2 per 10,000 injections, which is quite rare.
If you miss your second dose by the 45 days, do you have to start over and get the first dose again?
That's a good question. No, you do not. And so for a lot of other vaccines, and what we have learned through vaccine administration and antibody response over time is that it usually does not cause any less of an immune response to wait longer. You sometimes have a less response if you don't wait long enough. And we have had some instances when people have been sick or been in the hospital, had some other reasons where they've had to wait beyond the 45 days. And we've not seen any evidence or guidance that any additional boosters are needed in that scenario. It's thought that people are likely to be just as well protected, even if a couple of months go by between doses.
Great. Can you explain more what you mean by misting? You talked about misting a little earlier. Can you explain that a little more?
Sure. So what we have seen, so COVID has brought a lot of opportunity, right, for a lot of businesses to try to come in and help. And I think many businesses have good intentions, but we have seen that in some industrial settings that some places come in and they aerosolize or mist different types of sanitizing solutions. And I don't even specifically know what the specific chemicals are in some of these solutions, but they spray the mist up into the air and it will come down and land on a variety of industrial surfaces, perhaps areas that are kind of hard to touch or to get to clean adequately. But what I have heard about these is they actually may do more harm than good for the reasons I mentioned before. And really what matters are those high touch surfaces and that they be cleaned and sanitized regularly, not spraying mist into the corners of the room or behind a desk or somewhere where people can't really touch that anyway.
Thank you. This question might be for both you and Dr. Paul. Are some or all of New Hanover Regional Medical Center or Novant employees required to have the COVID vaccine, and why or why not?
I can actually answer. I've been involved in some of those conversations. So a couple of things there. The conversations are ongoing. I think most of us in the healthcare profession would love to see that eventually. So realizing that when these vaccines were initially released, they were approved on an EUA basis, emergency use authorization. So there had been absolutely adequate studies done, but certainly hadn't been to the entire population yet. Now we have hundreds of millions of doses under our belt, and I will say, at least in some of my background is pharmacology, is probably one of the safest vaccines we have really ever seen coming out of the pharmaceutical industry. We do not require the vaccine now. We highly encourage it, particularly if you're in patient care areas, but we do, at least at NHRMC, and I know the conversations have been at Novant, when the FDA fully approves, which we're expecting in the next month off of the EUA, probably those will be the conversations. So that being said, some of the industries have now begun requiring it, and certainly within their legal realm to do it, even as commented by some of our higher courts, particularly for the protection of the public. So, Dr. Bregier, do you want to comment on that?
Thank you. I have a couple also comments. Thank you so much, Dr. Paul. So we understand that there's some vaccine hesitancy, right? Some people are fearful about the vaccine. Some people think, oh my gosh, it was developed so quickly. How can it be safe? Well, as Dr. Paul mentioned, extensive clinical trials have been done showing its safety. And I was right out there. I put my arm out there as soon as I could to get mine. And I've encouraged my family, and my family has, those who are eligible so far have been vaccinated. And so what we encourage any of you who have concerns about the safety of it to reach out to your trusted healthcare person, whether it's your physician, your pharmacist, your nurse practitioner, a nurse that you know, someone who is knowledgeable and educated about this, because we are not trying to force anyone at this point. I also am in favor of everything we can do to save lives. That's what I want to do. I want to see less people die. I don't want to see the number go from 550,000 deaths in this country to 750,000 deaths over the next year. And keep in mind, numbers are increasing right now in many states. And many of the epidemiologists are predicting another surge may be coming soon because of Easter. So talk to someone you trust. I've had many people that I've worked with through the years reach out to me by phone or text or email and ask me questions. And please get the answers you need and get vaccinated.
Dr. Bregier, isn't ventilation a key issue to safe inside environments?
Ventilation is really important. And what is important is to try to remove the air that people are breathing, have as good ventilation that basically takes air out and away from people. The best way to do that is to open doors and windows for natural ventilation in smaller areas where outdoor ventilation is helpful. And in other areas, it's important to have good air exchange with the air ideally being sucked up and out and away from people. Newer recommendations have been for better filtering air filters called MERV 13. The lower the number, the less filtering, the higher the number, the more filtration occurs, and MERV 13 or higher is recommended if you have the ability to upgrade your filtration system. So yes, air exchange is really important.
And what is the news about helping long haulers get the vaccine?
It's important that everyone get vaccinated. So people who have had COVID, we don't know if they can or cannot get COVID in the future. We don't know if they can or cannot be affected by some of the variants that are out there. And to get the COVID vaccine in addition, after having had COVID, just provides a higher level of immunity. I understand that some long haulers may have more concerns about some ongoing symptoms they may have over an extended period of time. Everything that I have seen has encouraged everyone to get vaccinated because of the potential long-term risks of the additional both antibody response and other immune system responses that occur within your body to help protect you from COVID and other infections. And of course, if you're a long hauler, discuss it with your primary care doctor or other trusted healthcare professional if you have questions before you get vaccinated.
Well, I will weigh in on another component of that. There have been now studies showing that long hauler symptoms have been positively affected by actually the vaccine. So within actually 48, 72 hours after the vaccine, a lot of the mental fogness actually goes away. It still is not proven, still is anecdotal. I will say Mayo Clinic in Florida, Arizona, and Rochester, Minnesota are doing studies on this right now. If you know of long haulers, I would encourage them to get to a site because they are looking at active vaccine treatment for long haul symptoms. Still in its infancy. It's really, really early in this work, and I would not say go get the vaccine to cure yourself. I would say go get the vaccine, as Dr. Bregier said, to not get COVID again. I mean, that's the real part of it.
Thank you. The next question is, do I have to get my second dose at the same location I got my first?
You don't have to, and we have worked really hard to increase our communication and registration and information exchange with the North Carolina vaccination system that's responsible for this, and CMS and CVMS, excuse me. And so you don't have to, but it is easiest if you do. If you don't go to the same place, you go somewhere else, please remember to bring your vaccination card, because that is the easiest way to show what vaccine you received when, and that will expedite things for you. I think the ability to move around is only increasing as we get further into this. Any additional comments on that, Dr. Paul?
No, absolutely. I mean, see, our state has been very good with the CVMS system in some ways that it can track and you can get. Although I will tell you, being a site where we give vaccine, making sure our accounting is right, so we have the adequate numbers of second doses and first doses to go around. We would encourage you to go to the same place you got your first vaccine, but it is not absolutely necessary. We have given some second doses to people who have not received, but again, it's hard enough to track and store these things. We like you to go back to the same place, but you don't have to.
Thank you. So how long does it take for the vaccine to take effect for protection, and should we continue wearing masks after we've been vaccinated?
So it takes 14 days to develop what is considered to be a full immunity after receiving the vaccine. And it's really, for the 2-dose series, it's thought to be 14 days after the second dose. And yes, people should be continuing to mask and hand hygiene and socially distance the entire time while they're waiting for the immune response to kick in. There has been some recent guidance from CDC that has come out that has allowed for people who are fully immunized to get together indoors for social interactions and remove masks and actually no longer social distance. That's great news. Just keep in mind that you want to be aware of anyone you're around, especially if someone in the group you're trying to get together with is at risk for severe disease. And if they have not been vaccinated, you want to be very careful to continue to protect those of us in our community and our families that are most at risk.
This next question is very important, especially with summer coming up. When can I go back on a cruise ship? When will I know it's safe to go back on a cruise ship?
And Dr. Paul, you may have more to offer than this on this, but I don't know. I have not seen anything that indicates cruise ships will be opened up anytime soon. I think that because of the crowded conditions and the way COVID has spread like wildfire on cruise ships at the beginning of this, along with other things we have seen, other spreads of other waterborne illnesses and things on cruise ships. I think I personally would want to become very well assured that things are safe. And I think I'd like to have 6 months or more of cruise travel out there verifying it's been safe before I'm going to get on a cruise ship.
I agree with Dr. Bregier. There was some information, I think even on the news this morning, that some cruise lines are starting to reopen operations within the next 3 to 4 months. Strangely enough, their disembarkment sites are not going to be in the U.S. They're going to probably be in the Caribbean, probably skirting some of our rules, making the cruise that much more expensive. So I completely agree. It's a cohorted place. You can't tell who's vaccinated, who's not had it. It is a setup, basically, until we actually get adequate herd immunity, if that's going to be a thing. It's I would be hesitant. I like the 6-month rule. Let someone else do it first, make sure it's safe, and go. But I completely agree with that. It's kind of practical.
All right. And the last question we have, is there a concern that the vaccine could create an antibody-dependent enhancement?
I guess I'm not really completely understanding that question. I would say anything that we can do to improve our body's natural immune response to a variety of illnesses and situations is good for us. So having vaccines and exposure to things that help build antibody response to a variety of different viruses and bacteria is a good thing. Just like good nutrition is really good for helping fight infection, and hydration and sleep and exercise. It's a holistic approach. And if you really apply all these things to your life and wellness, we think that will go a long way for helping keeping you safe from COVID and severe consequences. And keep in mind, one of the more severe risk factors for severe COVID disease is, being obese. And we have seen lots of studies that a lot of people have gained COVID-19 through this pandemic, and that doesn't help.
I would certainly weigh into that. I'm a bit of a medical historian, and as an internal medicine specialist, I certainly do acquiesce that vaccines have probably saved more lives than most doctors. We just cannot get over how vaccines have really, really helped us in that realm. I will tell you from personal experience here at New Hanover, here in our county, here at our hospital, since we have vaccinated the vast majority of 65 and olders, our admissions to the hospital for 65 and over has dropped 90%. The vaccine works. Our ICU population, we don't have anyone 65 and older in our ICU anymore. And that is direct relation to that vaccine and what it has done. We were at a point during the surge in December and January where our hospital was almost overwhelmed. We really were at that point. We all were. The vaccine has not been the only thing, please let me know that, but it has been really what has helped us prevent that sickest of the sick. There was a question on chat, and Dr. Bregier, I'd love for you to comment on it too. It asked about, so if I get 2 doses of the vaccine, I can still get COVID? And I will tell you, yes, you can. It is 90 to 95%. That means 1 in 10 to 1 in 20 can still get COVID. But what it is 100% prevention of dying of COVID. Actually, all the vaccines right now, even the J&J, are showing almost, if not 100% prevention of mortality, which is phenomenal. And I'm selfish. I work in the hospital. I try to keep this hospital open so we can take care of all the sick people. That's where I'm going with. So Dr. Bregier, please comment.
Great comments. Thank you. The only thing I'll add is, and in addition to that, getting the vaccine has shown that if you do contract COVID, it tends to be a very mild case of COVID, really not much more than a common cold or other minor respiratory illness. So everything is thumbs up for the vaccine and its effectiveness and its safety.
Thank you. Dr. Bregier and Dr. Paul, thank you so much for your time today and your expertise and sharing with the community what we know about COVID and how we can get back to work safely. And to all of you that have joined us today, thank you so much for your time. We appreciate your willingness to listen and help keep our community safe. We are one of your new partners in healthcare, and we're excited to be working in your area. And we're here if you need anything. So thank you again, and I'll turn it back over to our friends at the chamber.
Thank you, Sean. And I'd like to add my thanks, especially to Dr. Bregier and Dr. Paul for spending this time with us. Thank you to those of you who joined and the questions. The information was fantastic. And I'm just going to underscore what the doctors have said to us today. Please remain vigilant in your own personal hygiene, wear your mask, keep your distance. It's summer. We're going to be able to be outside more again. Maybe we can lose that COVID-19, Dr. Bregier. But please stay safe. Let's get through this together. And again, thank you to our doctors from Novant Health today for joining us.
Thank you. Stay safe, everyone.